We're very excited to have Dr. Saunders here with us today. So he's a chiropractor. He's from New Jersey, recently moved down to Miami about a year ago, and he has grown the hyperbarics across pretty much United States and probably beyond. He does a lot of education with individuals who are interested in learning more about hyperbaric, and also he has a couple different hyperbaric clinics himself. Him and his wife are both chiropractors, and they are just passionate about growing health, wellness in the form of hyperbaric, along with other things that they do in their clinics to help promote wellness for those that they serve. So a little bit about the clinic. So we have now been open about 9 years, and we're over on 20th Avenue. So we've been in that location for almost 3 years. And we offer a lot of various things. We do offer primary care. We have 3 providers at the clinic at this time. We do a lot more nutritional recommendations, supplements. We try to figure out maybe more why somebody is dealing with a problem versus just trying to throw medication at them. So we do more along what's called the functional medicine route. We also, do just primary care, women's health, DOT physicals, sports physicals, hormones, thyroid. We just do a lot of everything. So if you're ever in need of, trying to find another primary care provider or wanting to maybe do a little bit different route of care for yourself or somebody in your family, please give us a call, think about us, and we'd be more than happy to see what we can do to help you. Patients have the ability to take control of their health. Sometimes they don't realize it until they're given the opportunity to do so. We don't always have to live the way that we think that we need to, and how everybody thinks we should age and whatnot. I mean, we do age, but we don't have to be sick, as sick as we are as a nation. So there's ways that we can definitely help you to get through certain, situations throughout your life, and maybe help you heal better than you ever thought that you could, especially as you do age. So, let us help you. That's what we're here for, and we love being able to help people change their life when they didn't maybe realize they could have that ability to do so. So, and sometimes it's simple things that make huge differences. So we're just passionate about helping people. That's what we're here for. That's what we do, and that is what makes us keep doing what we're doing. So
perfect. So at this point, I'll jump in here a little bit as the moderator for the little event. My name is Sean Sitma. For those of you who don't know me, and for those of you who are too young to remember, once upon a time I was on KX News here in Minot, but now do a lot of other things, including helping Trisha out with Minot Health Clinic's Hyperbaric Oxygen Therapy. So when she told me a little bit about this event, I was more than happy to help out and come and help. I think not only introduce, but then also I think elicit some conversations about hyperbaric oxygen therapy, and maybe help find some of those answers for a lot of people that may not understand all of it. So let's dive right into hyperbaric oxygen therapy. Really, what is it that HBOT does for the body that I think has been so profound for so many?
Sure. So let me just start by saying how I got into it, because I think that's going to help answer that question a little bit more. So we've been doing hyperbaric in our clinics for 17 years. And 17 years ago, it was like, hyperbolic, hypobariatric, what are you talking about? And so I had herniated a disc in my low back, and I had neuropathy and drop foot in my right foot. And for a year and a half, I suffered with that neuropathy. And I was a chiropractor. My wife's a chiropractor. My background is exercise physiology. I've been doing nutrition for 20 years. So I thought I knew a lot of what to do to help people. I was helping people's back, herniations and neuropathies for years. And I couldn't get myself out of this situation. And it was just an accident that I ended up in a chamber. And when I got in that chamber for the first time, that was the first time I had numbness and tingling in my foot. It's the first time I felt my foot in about a year and a half at that moment. And so that's when I bought a chamber and I started treating myself. And in about maybe 2 months, I basically had full resolution after a year and a half of that disc injury. And so that got me thinking, wondering like, wait, why didn't anyone ever tell me? I thought, I was 25 at the time, and I thought I was pretty smart. And I said, well, why hasn't no one told me about this before? Like, how did I get so far? Not that it was that far actually, but how did I get so far in my life and not know anything about this hyperbaric? My second patient was my stepdad, who at the time was diagnosed with primary progressive multiple sclerosis. And I had no idea if it would help him, but I thought, I had a nerve problem. He has a nerve problem. I made it that simple, even though my nerve problem was clearly very different. It was mechanical. It was a disc injury. His was an autoimmune disease. I still thought in my head, it helped my nervous system. It might help his. I don't think it could hurt. Let's give it a shot. And the impact that it had on him was very profound. His gait narrowed, the swelling in his feet reduced. He started walking stairs again. His cognition improved. I mean, it was tremendous. In literally under 2 months, we saw dramatic changes for him. So then my wheels really started turning, and I was like, what else would this thing help with? There wasn't really much research out there at the time. My third patient was a friend of mine. His mother had a stroke about 8 years prior. And I'm like, listen, I cannot make you any promises whatsoever. But I had a nerve issue. My stepdad had a nerve issue. A stroke is a brain issue, which obviously is affecting the central nervous system. I don't really think 8 years ago, I don't know if it's going to help, but I think it's worth a shot. We did 10 sessions only, and this was an 8-year post-stroke. And this woman, all she wanted, she used I always forget if it's needlepoint or cross stitch, one of those, one of these that, Thank you. I'm sorry. But she couldn't see the holes to put the big needle through, right? All she wanted to do was be able to do that. That's like literally all she was asking for. After 10 sessions, not only did she get that back, her gait also narrowed. She was using a walker. She no longer needed her walker. She was able to do her cross stitch. She was actually even able to read again. She couldn't read because of double vision. She was actually able to start reading again. So at that point, I was like, I have no idea what's going on here, but clearly we need to understand way more about this. And that's when I really started diving into the research and trying to explore it. To answer your question, what does hyperbaric do? Everything that happens inside of our body, right now, your body needs to make energy in order to sit here and listen to me talk. Your cells are constantly making energy in order to perform their jobs. And the fuel for that energy is oxygen. And right now, we're all limited to how much oxygen we can deliver because of the atmospheric pressure. The amount of atmospheric pressure is really what drives our ability to absorb oxygen from the air that we're breathing. What hyperbaric does is it creates a temporary increase in atmospheric pressure while you're inside that chamber. And so while you're inside that chamber and driving excess oxygen into your body, into your cells, you're creating a surplus of oxygen that would literally be impossible any other way. And when you create that surplus, all of a sudden your body now has an extra amount. It's almost like thinking about oxygen as a nutrient. And you're getting more of this nutrient so that your body could just do what your body normally does. As Trisha was saying, our bodies are what heal. We love to think as docs that, we're treating patients and we actually influence that system. And hopefully we have some effect, but ultimately not really. I always tell patients, I'm just your guide. I'm here to help you, but your body's got to be the one that heals and you have to be the one that does the homework. And so as you drive that extra oxygen, you're creating that avenue for the body just to do what it would normally do, which is help heal itself and heal itself faster. Oxygen is the rate limiting step to all the energy production inside of our body. And so when we go into that atmospheric pressure and drive that extra oxygen, we now can upregulate how quickly our body could heal and regenerate.
So one of the main questions that I continue to hear time and time again when we have the discussion about hyperbaric oxygen therapy is, why isn't this more widely used? Why isn't it more widely known within the healthcare industry today? Because I've seen the results just even with Minot Health Clinics folks that have gone through, done the therapy. I've seen the results in myself. What's the limiting factor here?
I mean, honestly, the limiting factor is education. There's not a single, so I've spent the last maybe 3 to 5 years teaching hyperbaric medicine quite a bit. And over the last 2 to 3 years, traveling all over the country, really all over the world, teaching medical doctors, osteopaths, nurses, nurse practitioners, chiropractors, hyperbaric technicians. How does this technology work? Why does it work? How do we implement it? And ultimately, how do we use it in this way to help patients that normally we wouldn't think that oxygen is the missing ingredient, when in fact, many times it is. And so I've had the luxury of traveling and having this conversation, and believe you me, I meet my fair share of resistance out there in the world. And I always invite it because there's literally not a single medical professional that I've ever sat across that within 4 or 5 minutes of just having a conversation about physiology will leave that conversation disagreeing with what we're talking about. It makes perfect sense, literally 100% of the time. The biggest issue is this. Who has had a pulse oximeter put on their finger? Okay, right? You go to the doctor, you go to the hospital, for whatever reason, you get a pulse oximeter. If you have no heart issues and you have no lung issues, that pulse oximeter should say 98, 99% saturation. The only reason a patient will ever get oxygen therapy as a standard therapy is if your saturations drop. Okay? The issue is that hyperbaric bypasses red blood cell carrying capacity altogether. The amount of oxygen you get into your body from hyperbaric actually doesn't use that normal system. You can't measure the effect of hyperbaric using that same device. But because in traditional medicine, we've decided that the pulse oximeter is the main tool to decide whether or not a patient gets oxygen, and unless you have a heart or lung issue, you'll have high saturations. Patients generally don't get that. Imagine this. Imagine I had a brain injury, right? Imagine I had a stroke. The issue with a stroke is that there's a loss of blood supply to that area of the brain, which leads to an immediate amount of hypoxia to that tissue, which means we're immediately getting brain tissue damage in this moment because no oxygen is getting to that tissue. If you put a pulse oximeter on that person's finger, what is it going to say? 100%, 99%. So are they going to get oxygen? No, of course not. However, we know that if there's damaged capillaries, which is basically what a stroke is, and you can saturate the plasma of the blood with oxygen, which is what hyperbaric does, you could immediately get increased oxygen to that tissue despite the fact that there's capillary damage. So in the short term, you're going to deliver oxygen to tissue that normally won't be able to get it in that moment due to the damage. Long term, you're literally going to heal the capillaries and regrow new capillary beds so that when you stop doing the therapy, that tissue can now self-oxygenate because you helped regrow all those capillaries once again. And so, there's a short-term reason to use it and a long-term.
And Dr. Saunders, this is when I'm going to turn to Trisha and basically look for that local intake on exactly that kind of circumstance. Trisha, you've had at least one or two different individuals that have come in with previous stroke circumstance. Tell us a little bit about not only coming in, but being, I hate to call it this, the last straw looking for some sort of relief.
So earlier this spring, we actually had a gentleman from back where I grew up from. He came up to the clinic because he had a stroke approximately 2 years prior to coming to see me. And 4 months prior to that, his nerve medication had stopped working. And he was in severe pain in his right arm and his right leg. And long story short, he got up here. He was to the point where you couldn't even lightly touch his arm, and he would wince away in pain. I mean, he was that severely in pain. And his wife was scared to leave him alone because he finally got to a point and said, I cannot do this anymore. And so I told him, I said, nerves take a long time to heal. They came up for a long weekend. I said, I don't expect you to see a lot of improvement, but if we can get a glimmer of hope out there, that's all that we need to say, you know what, we need to probably keep doing this. So he did 1 hour session, and then he was in red light therapy. And I said, do you notice anything? And he first shook his head, and then he touched his arm, and he looked at me, and he touched his arm, and he looked at me, and he just kept touching his arm. And he could touch his arm without the pain he had before. And then I lightly touched it, and then I tapped it, and his wife is like, that doesn't hurt? And he's like, No, it was good. And throughout that weekend, I think he did 8 or 9 sessions with Hyperbaric plus red light. He started to use that hand more than he has since his stroke. In the like getting ready for the shower, getting his stuff ready, putting his belt on. His wife said that she was able to finally joke with him again, because the past 4 months she hasn't been able to joke with him because he was in so much pain, and she's like, I missed that. He was saying more words than what he has said in the past 2 years. And then when he left, I mean, his whole mood, his whole demeanor completely changed just by getting that pain under control. They went home, got some red light therapy pads that they purchased from the clinic. And about a week or two, there was a snowstorm back home. And she sent me a picture. He was in his tractor using his hand controllers because he could now use his hand to run the snowblower on his tractor, which he couldn't do before. So, I mean, to be there to experience that moment where he could touch it, and like it made, I'll never forget that. I mean, that moment changed that guy's life, that family's life. You know, what would have happened if he couldn't have gotten this pain under control? And I'm thankful to be there to witness that. So, and that's one awesome story that we have, and there's plenty more, and there's plenty more to come.
And that's a perfect segue into kind of the circumstance of individual health. Dr. Saunders, when we talk about the therapy, hate to use the word treatment, but sometimes we are treating, but the therapy that is through hyperbaric is really in the case, if you would talk about the uniqueness to the individual and the body, there is no one specific answer to 1 hour equals this for every single person. If you could walk me down that road a little bit.
Yeah, I mean, we try to do research in all the fields in medicine to try to be as specific as, you know, in terms of protocols and this treatment for this condition, this treatment for this condition. It's going to take 5 hours for this, 20 hours for this. And the truth is, you know, you could have 10 patients that, you know, had a stroke all on the same day, and it's a year out exactly. You know, it could be the same part of their brain, or, you know, 10 patients that were diagnosed with MS 6 months ago, and it could look like it's a very similar presentation. Meanwhile, you know, you could put all of them in a chamber and you can have very, you know, varied results. Everybody's going to respond, you know, of course, differently. And, you know, part of our goal in clinic in general, and this is one of the things I love about what Trish is doing, is she understands that, and the need to understand each case and each person individually and create a plan. It's not just, oh, for this problem, we have this protocol. It's, no, for this person and their circumstances, there's this set of guidelines that we're going to follow. However, it's not always perfect in the first, right? It has to be, you know, we apply it, then we measure it, then we fine tune it, then we measure it, then we fine tune it. And in most cases, in individual care, it's got to be, you know, a team effort. You know, it's a teamwork thing. It's not just the doctor saying, you do this, you do that. It's, you know, we work together, I think, to really get people to that place, to that place. What I want to say is this. I want to say that with healthcare in general, and I hope that maybe this just resonates with a few of you out there. If you bought a plant, right, a beautiful, thriving house plant, you brought it home, it was tall, it was green, it was standing up nice, you brought it home, you were taking good care of it, and in about 7 or 8 days later, it starts to wilt, it starts to brown, right, it starts to show signs of sickness, what would you do? Water it. What else?
You got a florist here?
What's that?
Florist.
Some fertilizer, some sunlight, right? Talk to it. Some emotional therapy, right? What people wouldn't do is be like, well, we'll just spray paint it green, right? Or I'll just tie it up to a stick and make it stand up for a little while until, right? I mean, some people do, but in general, your first thought is something's missing, right? Something's missing in this plant and I need to give it back. And if I gave it back, it would do well. We're the same way. And yet when we show signs of sickness, we immediately start to go to the spray paint and the sticks, right? Instead of the healing. So if you wanted to do a research project for that plant, you'd have to isolate all those variables. You'd have to say, well, plants need water, they need sunlight, they need food, and they need, you know, new soil. And so you'd have to put one plant, right? One plant gets water, but it goes in the closet. and it doesn't get sunlight and it doesn't get food. The other one gets food, but it doesn't get sunlight, it doesn't get water. One plant gets, sunlight, but it doesn't get water and it doesn't get food. You understand? You have to isolate all those variables. So if you had a plant that was in the closet getting water, no food, no sunlight, how's it going to look in 2 weeks? It's going to look terrible. It's going to look worse. You're going to be like, well, clearly that plant didn't need water. How about the one in the sun that wasn't getting watered and wasn't getting food? How's that one going to look like? Crispy, right? You're going to be like, well, clearly sunlight not only didn't help that plant, it actually made it worse, right? My point is this: what did the plant really need? It needed all of them, and it needed them for a period of time. And you know that if you had all of them for a period of time, that plant would show and express normal plant health once again. And that's the issue in human healthcare right now, is that we're trying to always isolate all the variables, and we're trying to do one thing at a time. And at the end of the day, unless you have synergy between your different modalities, unless you have a practitioner who really understands these concepts and is willing to work with you and help guide you through that process, and unless you're willing to commit to a series of therapies over a period of time, you're never going to get the results that you're looking for. However, if you are willing to do that, and you are willing to commit to that process, and you do have a healthcare provider that's willing to work with you and love you in that way, I promise you, you're able to heal. And that's the key in my mind to this whole process. Oxygen, did that plant need oxygen? Guess what? You do too. Did that plant need sunlight? Guess what? You do too. And in times where we don't get full sunlight the right way, we use red light therapy. Your cells are sensitive to light. They need light in order to function properly. They need oxygen in order to function properly. So, I'm running around the country literally all year long, doing a lot of different trainings. I don't get an opportunity to do events like this very often, but when Trisha asked me to do this, I was like, hell yeah, absolutely, I will do this, because I love what Trisha's doing. I love what she's doing. I know what she's doing. We talk all the time, and I know that she's committed to this process. So if I can jump in and come up here and have a chance to chat with you guys and share some of my information and share what an amazing job she's doing out there, I just wanted to make sure that I was able to do it. So thanks again for your time.
Thank you.
That was amazing. We all got to see a little New Jersey slip out there.
It's usually a lot worse than that, I'll be honest.
I've only got a couple more questions, and then maybe we'll open it up for some other questions. The first one, I think, is pertinent to every single person, including the young players and the young staff here within the Hot Tots. One of the side effects that I experienced, and I've talked to a lot of other people that have done red light therapy, I'm in my mid-40s, and I've had a lot of wear and tear on my body. So I was treating a lower back problem, but it got rid of my arthritis. And then talking with some of the athletes that the Minot Hot Tots that are doing red light therapy for recovery, this isn't just about treating or doing a therapy for an illness down the road. This literally has application across the spectrum. Young, and let's call it our veteran society, our folks that have a little bit of age behind us. So if you would talk about just the wide scope of parameters, whether it's wear and tear after a game pitching on the mound, a concussion playing sports, a car accident, or a surgery. Dr. Saunders, you talked quite a bit about this, but this has an entire scope of possibilities.
So with red light therapy, for those who aren't familiar with it, what that does, it helps open up the vessels to allow more blood and oxygen to get delivered into if there is a target area we're trying to improve. So it's going to help bring more oxygen to that area so we can, revitalize, repair, regenerate, and get that area back to where we want it to be with or without the help of hyperbarics with it. When we think about red light therapy, I know when I first got them, I was like, this is a light pad. What is it going to do? Like, I did not believe in it the first time I heard about it, but I believed in it later enough to spend money to get them, but I still didn't use them. And then I had to be proven, it had to be proven to me that it actually worked. because I wasn't going to use something that I didn't really believe in and try to promote it because I didn't know anything about it. But I had a patient who used it, and I mean, she proved to me, to herself, that it made a world of difference for a foot surgery recovery. I mean, she used 3 pain pills her entire foot surgery recovery between red light therapy and hyperbaric. So, got a little off track there, but so from healing to targeting, that specific area, but also just works on the energy source of who we are. So we have it's called our mitochondria, which are the powerhouse of our cell, and that's what gets us the energy. It's like the gas in our gas tank. So red light therapy works on our energy sources, and it can when we have the healthy mitochondria, we have a healthy body. When we have low mitochondria and just low gas in the tank, we have disease, we have illness, and we can't recover from that like we need to. So, with or without hyperbaric, I mean, red light therapy works very well with it or independently of it. So I have been amazed time and time again with red light therapy and what it can do. And I know it's just going to keep showing us the power that it has. And people have to try to believe it, because it is still, for me, a hard concept to understand, but my goodness, it is powerful.
Can I add a second to that?
By all means, please.
I just want to add to that, and just to say that what's interesting about health, if you really understand, human biology, human physiology, which you don't need to, and there's no quiz at the end of this, but what you'll find is that virtually the same concepts or the same steps or the same therapies or the same things that you would do to help someone who has a chronic illness, particularly chronic illness, especially in the US, the same therapies that person needs to help get them out of that place where they are with chronic illness are virtually very similar, if not the same steps, the same therapies, the same concepts that healthy people ought to use to stay healthy. There's very little difference between them. And so, to your point in that question, I had that issue 17 years ago with that disc herniation in my low back. I haven't had that neuropathy since. I still do hyperbaric regularly for 17 years because I understand what it does. I know that I live in a world that I don't get to control all the outcomes of all the things that go on in my life. I travel a lot. I'm exposed to different things, including high levels of stress at times. My understanding is that oxygen plays a role in my body's ability just to recover from my normal life. Red light plays a role in my body's ability to recover just from my normal life. So it's not only a tool to use as a therapy for a person with a specific issue, it's also tools for people to use that don't necessarily have certain issues, but also don't necessarily want to end up with those same issues. Dementia is something that runs very strong in my family. And so pretty much my entire professional career has been me trying to figure out how to not end up where almost everyone in my family has ended up. And these are the tools that I've used all these years just for that reason. And it's more of like a sort of preventative maintenance model than it is like a treatment model.
So my last question here, and maybe this is a two-parter, but you drove all this way with a very nice van and a very big hyperbaric chamber in the back of this van. For those of us who know Minot Health Clinic, we have a couple of the soft shell chambers. We have a very large hard shell chamber. If you could, high overview, hard shell, soft shell, the difference, and if there is, let's call it one better than the other, or the point of it really depends on the circumstances, what you're trying to work through for the therapy.
As a good American, most people would think, if some is good, more must be better. We all have that sort of thought process, and that's just, especially in hyperbarics, that's just not true. What I would say is traditional hyperbarics was always hard chamber, high pressure. It's where, it came from the Navy. These guys dive deep all the time, and so diving deep in a hyperbaric chamber is necessary when you're trying to recover from diving deep in the ocean. And that basically just became sort of how things are done, even once it became a clinical tool. But what I would say is, all these years later, we're developing a lot of different protocols, myself and a few people across the country that are dealing with lots of different conditions all the time. And we have the volume enough to see what's the effect of different pressures on different people for different reasons. We're starting to see that there's trends. And so what I would say is this: there are certainly certain conditions, especially in the hospital indications, like certain really terrible infections or a certain injury that's really just not healing properly at all, like deep tissues, gangrene, osteonecrosis, really severe conditions where high pressure is just absolutely necessary, or at least more likely recommended. And then there's a whole slew of all these other things that we work with: post-stroke, Lyme disease, TBI and concussion, MS, ALS, a variety of different autoimmune diseases. And really, it's really more the mild to mid-range pressures that most of these people respond much better to. It's not about the amount of pressure in the moment you're getting it. It's about time. Your body takes time to heal. And so it's not that one treatment at high pressure is going to push you over the edge. No matter what, whether it's high pressure or lower pressures, it's going to take time to heal. But what we're seeing is this mild to mid-range of pressures really seems to be the key, along with a time of protocol, weeks and months, not hours and days. In our clinics, we use high pressure and low pressure. We use hard chambers. We use soft chambers. What I would say is, in some cases, a little bit higher might move the needle a little bit faster. But at the end of the day, we used soft chambers only for many, many years, and we got tremendous results with it. And so it's really more of a understanding the case, understanding the person, the individuality, and understanding how to apply hyperbarics. What we need to do is we need to apply the proper intensity of therapy to the proper severity of the case, of the person that we're dealing with. And in the overwhelming majority, the soft chambers are sufficient for the overwhelming majority of that.
Great explanation. And Trisha, is there any high-level things that we haven't talked about that we need to hit on for hyperbaric? And if you can't pop it off the top of your head, I'll loft one up here. It's called investing in yourself, so you don't and aren't forced to later in life.
Yes.
Okay.
So just as Sean said, we don't want to be sick. We don't want to be ill. And as I said at the beginning, we have the ability to make changes in our life. We just have to be willing to do it and to go the course. So I would say invest in your health, because until you don't, that's one thing that most of us take for granted. And sometimes it's very difficult to get that health back because we have not taken care of ourselves. So while you can, invest in you, because there's only one of you, and you, even though whatever's going on in your life, you are important to every single person around you, and you're important to people that you might not even realize you're important to. So you matter, and we can be there to help you get back to doing the things that you want to do, whether it's get on the floor with your grandkids again, go play ball with your grandkids, just do sometimes simple things is what somebody may need just to feel more fulfilled in their life with their family and whatnot. So we can help you do that. Let us help you. Invest in yourself, and we will invest ourselves into you to get you to that goal.
Original chambers were far more complicated. They've really simplified the technology quite a bit in a way where certainly clinics run soft chambers and hard chambers, and in some cases people put chambers in their home. Some people do put hard chambers in their home. Primarily, a soft chamber would be more appropriate in a home environment. But there's different versions of folks who, because again, this therapy is not something you do once or twice. It's something you're going to do for a period of time, most likely. And so there's a lot of frequency involved in that. And so some people are very local. It's very easy just to pop in and out of a clinic, and that's great. And for other people where traveling becomes an issue, renting a chamber is a possibility for a period of time to get the therapy you need to get over whatever the issue might be. Or purchasing a chamber could be an option for somebody that it's going to be a long-term vision where that's something that's going to be needed. In either case, it depends on what type of equipment you're getting, which would require what kind of training you would need. But again, these are pretty easy to operate. So it's not an extent, you don't need, I teach a 40-hour, hyperbaric medicine course to, you don't need all that. It's, an introduction to just operating the equipment, making sure people are safe. And, that bigger chamber there, that soft one, that was originally designed for a mother and a child, right? So the child needs the treatment and the mother or the father might be going in the chamber. And so it was designed with that in mind, with no medical training whatsoever. Can you operate this very easily, very safely? And so, they're pretty well designed that way.
Very good question.
Can you get too much is the question. So, like anything, right? I said more isn't better. And yes, of course, there are limits. Now, in that soft chamber, you could try to figure out a way to get too much where it could be dangerous. It will never be dangerous. At higher pressures, absolutely. Now, a lot more thought needs to go into that. More planning needs to go into that. And there's a little bit more risk involved at higher pressures that somebody has to be much more aware of the pros and cons and the potential consequences. In the soft chamber, there's still a proper protocol. Again, you don't just stay in there for 3 weeks straight and you don't come out and you come back, but yeah, you could really use it quite a bit and it would still be, hours a day would still be very safe. It's sort of unavoidable. So yes, typically we would run, the way those are set up are air only. In some cases we would run air only. In some cases we would add some additional oxygen to a setup like that. And for the most part, if we did that, maybe the child is going to be getting the chamber and the additional oxygen, whereas the parent might be getting the chamber only. But even the chamber only is actually a very significant therapy. So yes, the parent does get that additional benefit for sure. The short answer is yes. The medium length answer is, we're probably getting about 3 to 5 new patients a week in our office just for brain fog or long haul, whether it's lung and breathing issues and energy related or neuropathies associated. And literally, I won't say 100% because nothing's ever 100%, but I can't even think of a patient yet that hasn't responded and virtually fully recovered in 20 hours or less. And so, yeah, it's been a really, really important tool for a lot of those patients.